All right, today, friends, we're doing a 3000 FUT or follicular unit transplant. We're going to be following our patient's amazing hairline and giving her thicker and fuller hair. We're going to fill in where she's missing hair, which is the crown area. We're going to round out the hairline. And for the crown, we want to fill in this area that gives our patient discomfort and make that more full. With each session, we can do 3,000. That's the most our team can do in one session, which I feel is a lot. It's 3,000 follicles, but each follicle has between 1 and 6 hairs. So you'll end up with more than that. Our goal today is to give you more thickness, more fullness, and make you more comfortable. We're going to focus on filling in the peaks that you don't like, making the front a little bit thicker and reinforcing the hairline, and filling in the crown as much as possible. Now, some people, in what we do call the crown, a black hole. You know what a black hole is? Yeah. Like space, right? Nothing escapes it, it sucks everything in. And the reason they call it that is because the crown just takes a lot to look full. But I think you have some good hair there, so we can make it better. So our plan today is we're going to fill it in from here, fill in these peaks you don't like all the way here, and then we're going to go back here and here to here.
Okay.
Okay?
Yeah.
It's going to look, you look already so beautiful, we're going to make you more, okay?
I appreciate that.
Of course, it's true. So our plan is in the OR, IV, get you a little relaxed, nerve block, take the strip out, you're going to hear and feel some noises, stitch that up nicely, make a grid pattern for the transplant. We'll make holes in the grid, then we'll put the hairs in, okay? So it'll be 4 of us working together, trying to get this done beautifully and nicely, okay? All right, friends, we're doing a 3,000 graft follicular unit transplant today. We'll be making our incision first. We're going to use a number 10 blade, and what I'm going to do is I'm going to make a trichophytic incision, or I'm going to make an interlocking, interdigitating incision. I'm going to start from here. And I'm cutting at an angle, so that way the hair from the top and bottom of the scalp can lock in together. Now that we have the strip cut, we're going to gently remove it. We're going to grab the strip. Fantastic. All right, friends, we're finishing our suture. What we're doing is a running suture, or dissolvable suture. It's called chromic, and I feel this gives me the least scarring, gives me good support, and it's dissolvable. So you don't have to remove it so it doesn't hurt the patient. We're gonna start with the nerve block first, okay? So we're gonna stay away from the brain, but we're gonna numb the nerves that go to your scalp, so we can do the holes properly. So the first thing we're going to do is we're going to block what's called the supraorbital and supratrochlear nerves, okay? Okay. You're going to feel a little pressure on 3. 1, 2, 3. Good. Now we're going to get the supratrochlear nerve. 1, 2, 3. Good. That's going to kick in over the next few minutes. Now we'll get the other side. 1, 2, 3. Great. Okay. So by making a grid and putting a specific number of grafts per box,
A big deep breath.
we feel we get the best results. All right, friends, we're making recipient sites for her grafts. We marked everything. We have a specific grid pattern made where we're going to make a fixed number of holes per grid. We're going to start in the back here. Perfect. Very low bleeding, that's what we want. All right, friends, right now we are doing our implantation. These are our recipient sites. This is the follicle, and this is an example of a single hair follicle. You can see there's a follicular unit here with a single hair going through it. We gently take this with special tongs, and we put this into our recipient site. Just like that, and it's going to grow in there beautifully.